Good morning, delegates. We are about to start the program. Good morning, delegates. Shortly, we are about to start the program.
A warm good morning to our respected management, esteemed faculty members, and dear delegates. On behalf of Department of Anatomy, Sridevi Institute of Medical Science and Research Hospital, Tumukuru, we extend our heartfelt welcome to each and every one of you today.
We are truly delighted to have you all gathered here for this continuing medical education program centered on artificial intelligence in healthcare. We hope today's sessions prove to be both insightful and highly enriching for everyone.
We will now begin with our first session focusing on the current landscape of future directions of artificial intelligence in healthcare by Dr. Shivleela C.
To preside over this session, we warmly invite our chairpersons, Dr. Nagashri MV, Professor and Head Department of Anatomy, BGSMCH, Nagrur, Bengaluru. Dr. Bindurani MK, Professor Department of Anatomy, Shri Siddhartha Medical College, Tumkur. To kindly take the chair.
I now request Ms. Febamol ma'am to introduce our speaker.
Good morning to all. It is my pleasure to introduce Dr. Shivalila C, Professor and Head Department of Anatomy. She is a distinguished medical educator with extensive experience in teaching, research, academic leadership, and she has an impressive academic profile with 40 publications, more than 30 scientific presentations, 4 best paper awards at national conferences. Her strong interest and commitment to medical education and reflected in her qualifications, master in medical education, postgraduate diploma in medical education, advanced course in medical education, national teachers training course from the Dept. With her rich academic and educational experience, she is ideally placed to open today's CME with a section Artificial Intelligence in Healthcare, Current Landscape and Future Directions. Please join me in warmly welcome Dr. Shivalila C and wishing her a very informative and engaging section. Ma'am, we are warmly welcome you.
A very good morning and warm welcome to all the delegates. So my topic for the first session is artificial intelligence in healthcare, landscape and future directions. So the objectives for this session to describe the evolution of artificial intelligence in healthcare, to recognize the major AI technologies which are currently practicing in the medical influencing in the medical practice, to appreciate the AI impact on clinical care, education, and also on the research. Then we have to identify the emerging opportunities and limitations of AI to prepare responsible AI adoption in healthcare. So I think all of us, why artificial intelligence? I think all of us in everyday practice, we are already using the AI. I hope before ChatGPT also we were using the AI. From morning, I think after waking up, all of you must have used any of the AI. So why AI is there everywhere and why not in the healthcare? So now AI is emerging. It was evolved in 1956 back, but now it is emerging in the healthcare. So why AI in healthcare is needed? Because of the increased patient load, physician burnout, the overload of the information, the explosion of the medical literature, and the shortage of the specialists. So AI is already here. So I think you all know, we think that ChatGPT we have started, that is the first AI tool. But before the ChatGPT itself, we were using all the embedded AIs, which were invisible. For example, Google search. So whenever we search, so it predicts the relevant information which is to us, whatever we are searching. So whenever we put it gives an option what we are searching. So that is again invisible AI what we are using. Then we have smartphone cameras which automatically recognizes, optimizes images. So that is also one form of AI which we have been using a long time. Then we have got voice assistants, which will convert the speech into commands. Right? Then we have got filtering in emails. So it detects the spam. Then it prioritizes whichever mails are there. Right? And it blocks the spam. It takes the unwanted things to the spam. Then we have Netflix or other Amazon Prime and all, where whenever you open it, so it shows the data, what you may prefer. You may prefer this to watch. So that is all invisible AI we have been using since a long time. And also bank fraud, any unusual transaction, so immediately you will get a message. So that is all embedded AI we can say, or we can say the invisible AI. So we have been using AI before ChatGPT, but we may not think that these are all AI tools, but this is all is invisible AI. What we are using ChatGPT more, that is your generative AI. It is giving information, but we are in a false belief that we have started using the ChatGPT and then we are in the AI now. But before that, we were already using the AI tools. So since recently we have been using all these regularly, ChatGPT, GPT-4, Gemini, Claude, Notebook LM, Perplexity, AI Agent. I am sure that most of you are using already this. And at least who are not using, they are familiar with these terminologies. So what is AI? So it is a broad terminology, we can say. Artificial intelligence is a broad concept. In that subsets are there, but nothing is going to replace anything. It is the artificial intelligence, you can say it's a broad concept, and in that machine learning. So artificial intelligence, so you instead of human intelligence, it is giving the answers. When we say artificial intelligence, machine learning, we have to feed the data so that repeatedly we need not program the rule again and again, so that the data is fed and then the machine starts learning. Then we have got deep learning, the deep neuronal networks, which help us in getting the major advances now. For example, image, audio, video, everything we are getting now. That is your deep learning. Then the generative AI. So when you give a prompt, it gives the answer. It gives the answer in the form of either image or so that is called as generative AI. The ChatGPT is an example for generative AI. Then we have agentic AI. This is still more. It uses multimodal. So many things, many tasks it utilizes and it completes the goal. So we call them as AI agents. So these are all these subsets. One cannot replace the other. Agentic AI. So all these are there in the background. So the most recent is AI agents. So we have got types of AI agents now which are being used in medicine. So predictive AI. So whether a patient goes for a risk of sepsis, okay. So that the AI agent is predicting that. So that is called as predictive AI. Then diagnostic. So for screening of diabetic retinopathy, we use the AI tools. Then generative AI. Then you have multimodal, multiple tasks combines. Then we have got the most recent ones is the AI agents. These are all being currently used, and still they are still developing many apps on this. So for example, across the patient journey, what are the AI we can use? So for symptoms, we are already using it. So AI symptom checkers are there, which can detect the symptoms. Chatbots, virtual assistants are there. Triage and risk stratification predict the deterioration risk. Then for diagnostic AI, so we have clinical decision support systems. We have AI assisted pattern recognitions. We have got the natural language processing of data, patient data, and it gives suggestions also for differential diagnosis. Then for investigations, so smart test recommendations, AI image analysis, especially we use for image reading in radiology, right? And even in pathology. Radiology is the field where most of the AI is currently being used, and also in pathology to assess large sample size. Okay, a lot of diagnostic they are already using the AI. Then automated report generation. All these things are for treatment options. So treatment option ranking, precision medicine genomics. Then for monitoring, we have got early warning systems by the AI, remote patient monitoring. So all these things, especially by ambient AI, we can use it. Then to follow-up reminders, AI chatbots for patient support and risk of readmission prediction. So this is all AI which is used across the clinical care. So 7 important uses to summarize. So predictive analytics for early disease detections, then virtual health assistants we have, then personalized treatment planning, remote patient monitoring, radiology, as I said, in the medical imaging to get the report, drug discovery and development, precision medicine and genomics. So surgery. So already we are in the robotic era. Already robotic surgeries are already going on. So you have nano robo, you have Da Vinci surgical robo, continuum robo is there. So through the augmented reality, virtual visual odometry and camera localization, kinematics, dynamics modeling, learning from demonstration. So many things are there which are already happening in the surgical field. Already AI is in use. So how we are using in undergraduate medical education? So the applications we include the virtual tutoring, then clinical simulations, which we are using in the clinical research or to train the UG and the PG students, in automatic quiz generation, which is most helpful for assessment, then diagnostic assistance. Then what are the benefits of AI for undergraduate medical education? So we have, it increases the learning, then increases the efficiency in the student support, then personalized feedback it gives and improves the exam preparation. What are the challenges we face when we are using the AI for undergraduate medical education? So mainly accuracy concerns. We are concerned about whether it is accurate or not. When you generate a data in the chat GPT or infographics you get, many of the mistakes will be there. So a human oversight should be there for while using AI. So accuracy concerns are definitely there. Then data privacy. So definitely personal information, when it is fed, it already generates whenever somebody asks it. So data privacy issues are there. Ethical considerations and dependence. We get adapted to the AI. So what are the recommendations? So we have to train the students on AI usage. Then ethically how you should use, and always human oversight should be there while using the AI.